Stuttering Severity Instrument 4. And I am going to, before we get into that though, I wanted to summarize for all the different assessments that you can do for stuttering. Also, this document is on Moodle. So for you guys who are virtual, you can find this document on Moodle. For those in-house, I did print it. It's up in the front. Whoops. Come on, go back. There we go. All right. So, so let's look at the assessment of stuttering. You guys at home seeing the PowerPoint? All right. So if, as you see on this sheet of paper that I printed up for you, or those of you at home who have it electronically, there are many different ways that you can assess someone's disfluency. And when you assess the disfluency, you're going to utilize several different ways. And as you become more and more proficient with assessing stuttering, you will probably fall into certain routines that you will use when you do your assessments. So when you look at someone who is disfluent, or a person who stutters, you might assess them based on the frequency of their stuttering per 100 words. Now, the key here to remember is that this is not a percentage. This number that you receive from this is not a percentage. It's going to be the number of stuttered words or syllables, if that's what you do, per 100 words. So that's just, it is just that. The person exhibits 5 disfluencies per every 100 word on average. Okay, so you're going to count more. The thing with counting the frequency of stuttering is that it does allow you to also count the frequency of syllables. So certain words could be counted more than once. So if the person, if you're counting syllables and the person is disfluent, like let's take the young boy who said facted, okay? He's disfluent on the for affected, and he was disfluent on the second syllable. Okay, so he was disfluent on 2 syllables, so you could count that as 2. Whereas on other measures, you would only count, if you're looking at disfluency of words, you would only count that as 1. So, but whatever method you choose, whether it's words or syllables, you just need to be consistent throughout. Then you can get a percent. Remember, this first one is just a frequency. It's not a percent. You can look at the percent of syllables or stuttered words. So there are multiple types of percents that you can get. You can get the number of stuttered words. So you can calculate that and get a percent of words stuttered. You can get a percent of fluency, counting the number of times the person was fluent, the number of words they were fluent on versus disfluent. And you can also count the percent of intervals. So with counting the percent of words stuttered, you're going to count the number of stuttered words, multiply that by 100, and divide that by the total number of words. That'll give you the percent of the words stuttered. If you're using syllables, you count the total number of syllables, count the total number of stuttered syllables, and do the same calculation. If you're counting the percent of fluent words, then you're going to count all the words and count all the words where they were fluent. So this number will give you a percent saying like 75% of the time the patient is fluent. Okay, so that means that 25% of the time he was disfluent or she was disfluent. Another percent measure that you can get is the number of stuttered intervals, looking at the intervals. And what you're talking about when you're looking at intervals is judging whether there's a 3 to 5 second time interval in the sample containing the stutter. So if the person has a block that progresses for more than 3 to 5 seconds, then that's going to count that as an interval. And you count up those intervals, and that gives you the percent of those 3 to 5 second intervals, or 3 seconds or more, because some intervals can be longer, that were disfluent. Okay? So that's another method that you can utilize. The other one is look at the frequency of the various types per 100 words. What do I mean when I'm talking about types? Yeah, prolongations, blocks, or repetitions. So how many repetitions did they exhibit? How many prolongations did they exhibit? How many blocks did they exhibit? But it can even go deeper than that. How many part word repetitions did they exhibit? How many whole word repetitions did they exhibit? So you can see how your analysis of a disfluent patient can be very detailed. Another measure, when you're analyzing the frequency of the various types, you want to look at the number of interruptions and specify what they were. So when they have a disruption, you will label it as a repetition, a block, okay, or a prolongation, etc. Okay, the other tool that you may use is a fluency frequency index, or FFI. Now, a fluency frequency index is not used to determine the severity of a client, but it's used to help with therapy, or help you to see whether or not you're making progress. So when analyzing their frequency, you base it on the number of fluent words compared to the total words. Now, this isn't a percentage, okay? At the top, we were talking about the percent of fluency. This is a count, okay? It's providing you information to see whether or not the therapy that you're making or doing is being effective. Is the person being successful with this technique that you're teaching them? So are they decreasing the frequency per 100 words or syllables? Or total number of words. This one doesn't have to be a set number. And as you can see there, what I have written there, it can help the client focus attention on fluency rather than disfluent speech. You know, so much of the time when you're working with someone who's disfluent, that's their focus, because it is part of their life. It is how they have to live each one of their days. They have to live with coping with this disfluency. Whereas if we use that frequency index, excuse me, hang on, I'm thinking two things at one time because this mask keeps falling off. My mask keeps falling off my face. I need to make sure that's mine. That's clear. So I'm going to change directions. So I can quit messing with it. Okay. All right. So what I was saying was, with the frequency fluency index, this helps the client to be able to focus on their fluency. So you can do this and say, look, you've learned this technique and now you're 20% more fluent than you were a month ago. Look how much you have achieved. And so it helps the client to be able to focus more on their success, their fluency, rather than disfluency. How else do you see this helping with them focusing on their fluency versus disfluency? Okay, so maybe to decrease their anxiety. What was the other thing you said? Okay, so maybe to help to decrease their anxiety, to realize that they are, hey, I can be fluent and my fluency is getting better. So that helps to decrease that anxiety. What else can it help to change? Negative emotions. Okay, so good. So anxiety and negative emotions, correct. So their frustration, um, instead of the negative side, looking at the positive side, it can help improve their outlook. It can improve their willingness to communicate with others. So, doing this type of an account will help when you're doing treatment to reinforce the therapy that you're doing. Another measure that you can do is the stutter-free periods of speech. Looking at the average duration of the 3 longest non-stuttered intervals. Remember, intervals being 3 to 5 seconds. So looking at the 3 longest non-stuttered intervals measured in seconds and or minutes. And then you take the average length of the 3 longest non-stuttered intervals. And that gives you their longest stutter-free period. Now, when you're doing calculation with time, you have to remember what? You're not dividing by 100, right? What are you calculating by? We're talking time. 60. Yeah, minutes. If you're going to be how stutter free were they during this many minutes? You're going to have to take your total. If your sample was 30 minutes, you're going to have to figure that calculation based on time. It's not based on whole number type of thing. So keep that in mind. And we're going to see that again later when we talk about another area. Percent time disfluent. Of course, this being the opposite of our fluent time. Summing up the duration of all disfluencies in a sample, then calculating its percentage of the total duration of the sample. This is only useful in therapy. This, again, is not something that's going to give you a therapy pattern, okay? But it's helpful for you to keep abreast of your treatment and whether or not what you're doing is being successful. All right. Speaking rate. Here's another area that you might assess for someone who's disfluent, their speaking rate. The higher the frequency of disfluencies and the longer their duration, the slower the speaking rate. Does that make sense? The more disfluent they are, the longer it's going to take them to get through their sentence. So their speaking rate's going to be slower overall, okay? Individual words, and we've seen this in some of these samples, their individual words or phrases may be fluent, or maybe at a normal pace, but overall, their ability to produce that sentence is going to be longer because they have these interjections of repetition, prolongations, and of blocks. So that's going to make the time for them to produce a utterance longer. All right. So you can assess this in multiple situations, and you should, because, well, you tell me, why should you assess this in oral reading, in conversation, and in picture description? Why is it important to test speaking rate in these 3 different areas? Different environments, and what does that have to do with it? Okay, so the environment itself could make a difference, but what else?
Speaking rate might change depending on if during a conversation.
Yes, exactly. Your speaking rate is going to be different whether or not you are in a conversation, just a casual conversation, or you are reading an oral reading, or you're describing a picture. In a conversation, you're in this rapid back and forth turn taking situation with someone else, and we don't necessarily spend a whole lot of time pondering what it is we're saying. Okay, it just kind of comes to us and we communicate. When we're describing a picture for someone, we're trying to come up with a specific response. So that's going to take a little bit longer. Oral reading rate, speech rate is going to also be different because we are assessing each one of the words and have to make sure that we are producing each one correctly. So you need to assess speaking rate in all three different avenues, and then you're going to try to get an overall speaking rate. So your overall speech rate is going to be how many syllables were spoken in the time needed to deliver an entire message or read a complete passage. Now, it's important that when you do this, you're only clocking the time where the person that is assumed a stutterer is speaking. So if you're doing this in conversation, then when you're watching the video, you're going to have your stopwatch and you're going to be clicking that stopwatch when the person who stutters speaks. And then when they stop and you interject, you stop that stopwatch. If they stop to think about something, not a disfluency, they're just, you ask them a question and they're like, I don't know. It might be, you would pause that timer during that short interval because that wasn't a disfluency. That was just them pondering, thinking. So you make sure you only calculate the total amount of time that was actually part of the person's conversation. Now, if he did, I don't know. Well, I'd have to think about it. Now that you would, even though there was a pause there, you would conclude that pause because that was due to a disfluency. That makes sense? Okay. So you're looking for, when you're calculating overall speech rate, you want to include only those instances that relate to the person's actual communication. And then you're going to do this, you're going to take the same sample and you're going to time it at least 2, preferably 3 times. And then you're going to take the mean score. Mean score meaning that you're going to put them in order, highest to lowest, and whatever that middle score is the one that you're going to use. Then you're going to take the total amount of time. You're going to calculate the rate by dividing the number of words or syllables in the conversation, in the oral reading, or in the picture description, and dividing the number of words or syllables by the amount of time. Remember, when you're dealing with time, it's 60 minutes. Okay, so keep that in mind with your calculations. The other thing that you need to remember, and we have a tendency to do this or want to do this, is that you might pull out a oral reading that the instruction says this has 200 words, and you record the person reading that passage. And you just arbitrarily say, well, that was 200 words because there were 200 words in the passage. But if you listen closely to the video, the person left out a word or two. Or when it said that is, he or she said that's. We do that all the time. Okay, we just automatically have the tendency to do that. but that changes your total number. In that instance, you don't have 200 words, you have 199. Okay, so you need to make sure that you carefully listen to your recording, you have a good recording, and you analyze and make sure that your numbers are correct, because it's going to affect your bottom line or your final response. The other areas that you're going to be assessing when you're assessing someone who stutters is their attitude. What's their attitude about their stuttering? What's their attitude about the people they speak to? What's their attitude about themselves or their environments? So you need to analyze their environment. This is particularly important when you're dealing with preschoolers, because we need to be able to know what's their awareness level. Are they giving us any indication that they avoid speaking? Are they giving us any indication that they are aware that they're having speech problems? Tell me why this is significant. Why is it important for us to know this when we're assessing our child? Okay, so if they are more self-aware, then it's probably going to affect the treatment. Yeah, but even before that, what is it going to affect? Before you even get them in the treatment, their self-awareness is going to affect what? You guys at home are too quiet today. Cassie, what can it affect?
It might affect the severity of their stutter.
Okay, so if we find out that the child is not aware of their stuttering, and it's a very mild stutter, what's your, and they're not showing any other avoidance and so forth, what's likely going to be your recommendation? Typical responses? Typical disfluencies. Okay, so your assessment may be that this is typical disfluencies, and so what's your recommendation going to be? Right, your recommendation will probably be that they don't need formal therapy at this time. However, the child might not, but what will your responsibility be as the speech pathologist? You might not put the child in formal therapy, but what would your responsibility be to that child? Anna, you have any idea? I'm gonna pick on people.
Not really. Other than just like being aware. I don't know, kind of like what I think it was Elena has said that like if we're aware of how they feel, like that's gonna affect how we're gonna proceed, because like if they're willing to work because they know that they have a stutter, I guess, like they're more aware of their feelings about it, they want to fix it, or maybe they're just completely negative about it and don't want to do anything about it.
Well, if we have a preschooler who is not aware of their stuttering, it's a mild disfluency. We're talking preschooler, okay? What is our responsibility to that child as the speech language pathologist who has done the assessment? Amanda, you have an idea? No. Come on, guys. We're talking preschoolers. Anytime you're dealing with preschoolers, who else are you dealing with? Yes, you're dealing with the parents, okay? So if I have a preschooler who is not aware of their disfluency, they're having mild repetitions, what is my responsibility to that child? It's right. Well, I mean, we could. It's a typical disfluency, normal, not normal disfluencies. But what is my responsibility to that child? Am I just going to say, no problem, have a nice day, have a nice life, see you later?
You can educate the parents.
Yes, thank you. Education, educating the parent. We want to make sure that child continues to be unaware of their disfluencies. So what kind of what kind of things are we going to talk to the parent about? Decreasing stressful situations. What else?
Being patient with the child.
Being patient. Yes. What else? Use a different tone. Okay, good. What else? Okay, getting on their level. Very good. All very good responses. Okay, so we need to educate. Don't call attention. Give them time. Be patient, right? Don't let other people call attention to them. But do we want them to not talk about it if the child wants to talk about it? No, we can, but we need to do it in such a way that we let them know that, hey, you're you. Do you. It's okay. It's not a problem, you know? So to help to relieve that stress, we don't want to increase their stress. Okay, let's move on because I'm getting too wordy. Okay, another thing that you'll have to assess is their anxiety, their temperament, and their personality. This is particularly important for preschool schoolers, preschool age children. Just like I was just talking about this little one who may not be aware of their problem. They may be mild, but you find out that they have a very reactive temperament. They are highly anxious. They respond very negatively to any kind of stress that is occurring in the family. Okay, so might that change your perspective in what you're going to do? Why? How? Tell me. Lacey, you were shaking your head.
Well, because if they get more anxious, they can get like more of a fear of stuttering.
Okay, yeah, good. So if they have more of an anxiety temperament, they might be at a higher risk to move from a typical disfluency to beginning stuttering. So, this is definitely one of those that you might say, okay, let's just kind of keep a watch on them, educate mom and dad about, keeping the calm environment, but let's check him back in like a month or two and see what's happening. And that might be one that you follow up on. Or you might recommend that, he sees a counselor or some other type of professional who could help to change that temperament, especially if you find out that child has some markers that puts him at a higher potential to be a disfluent child. So the key here is when you do an assessment, it's not just in this one little space that you follow these one little things, okay? Everything makes a difference, from their attitude to their family. It's not just about the words that they're saying that are disfluent. It includes more than that. And then finally, the last thing that, of course, you're going to assess is their secondary symptoms. Are they exhibiting some secondary symptoms? That is indicator that they are definitely true stutterers, okay, when they start exhibiting secondary symptoms. Okay, now, the other thing that I have on this sheet, for those of you who are looking at it at home and in here, the stuttering severity. This refers to the level of disruptions in the delivery of continuous speech. Now, we're talking specifically right here about the oral productions. Overt stuttering severity, however, does not necessarily reflect the impact of the total stuttering disorder, which is what I've just been talking about all morning, okay, and just said. is that you can't not just look at the severity of the words. Oh, he's got, he's only 5% disfluent, so doesn't really need therapy. But this child is not going out to talk to his friends. He's doing horribly in school because he won't participate. It doesn't matter whether it's a mild stutter or it's a severe stutter. If it's affecting them in other ways, then it's not like language where they have to be 1.25 standard deviations. Stuttering is different. Stuttering is different. We can qualify students for disfluencies because it can have far-reaching problems. Not that language can, but disfluencies definitely are problematic. Some speakers do plenty of stuttering, but experience minimal emotional issues. We saw 2 of those on our screen when we watched that video of the disfluence, the people who stutter who became speech language pathologists. They learn to live with it and they don't let it bother them. They have no emotional issue with it. But if you look at particularly that second video from the test, that was pretty significant. Okay, so those all make a difference. Other speakers stutter mildly but experience intense disorder due to emotional deficits. Clinicians often rate stuttering subjectively just on observing a client. So, like I said, you might do an assessment and the client, according to this table, shows that they're mild, but yet looking at the secondary symptoms, looking at how it's affecting them, they're more like a severe, okay, because of those issues. So clinicians, as you get more practice with doing assessments and working with people who stutter, you're still going to need to do your formalized test, but you will begin to get, he's got a pretty significant stutter there. Even though he's saying this may be look orally, it's mild. Overall, it's pretty significant because of how it's affecting his life. Okay? All right. So everyone should have gotten an SSI packet. If you have not gotten an SSI packet and have not contacted me, do so that I can get you, or you can make arrangements to come and get your packet. And the project that you're going to do with the SSI is you're going to give this assessment. Let me see. You know what? I think nope. Oh, there we go. Okay. So we're going to do this first. So this is the project that you're going to do. This activity is 50 points and it must be completed in order to pass this course. If you don't do your SSI, you're not getting the passing grade. Okay? First thing you want to do is read the testing material and familiarize yourself with the administration instructions. Ideally, this is not going to work for everybody. Ideally, if you can test a young child around a 3rd grader who can read, that's great. Some of you will not have that. Some of you might need to do this on a peer. Okay, I get that. But it's better for you if you can do it on a younger child. Okay, but I understand if you can't. It can be done on anyone because it's for all ages. But at least 3rd grade, or if you can find a child, that'd be great. Follow the instructions for administering to readers. Okay, there are 3 sections on here. You have speaking sample, reading sample, and beyond. So you're going to want to do those sections. Step 1, administer the assessment and videotape it, because you need to videotape it so that you can analyze it. Make sure you're setting this up that you're going to be able to hear and get a good sample. You might want to test it before talk to the person, go back and play your video, and it's like, okay, this is going to work. Or maybe you're finding that there's something running in the background that's interfering with the volume, with your being able to hear, like the air conditioner is right above you. So check that out beforehand. Step 2, administer all 3 areas: clinical speaking sample 1, sample 2, and clinical speaking sample 3. Step 3, you're going to transcribe and analyze per the instructions for each section. Step 4, you're going to document results on the following pages and on the protocol sheet, which you do not have yet. I'm going to post this, okay? So I'm going to post the protocol sheet, so you're going to be able to have that for you. We don't have enough of these to be able to give everybody out, so I figure I'll just put it electronically. Next, okay, this is part of what you're going to turn in, because you're going to turn in your sheet and this sheet. Notice I said remove all red text before submitting. So that red text is instructions. Just go in there and delete it out of there. What you're going to do for part 1, clinical speaking sample, that's the reading task. Indicate the reading level of the individual you're assessing. So if you're assessing a 5th grader, if you're assessing a college level student, indicate that. Mark the number of syllables and the percent of stuttering severity for the reading section. Now, granted, most of you are going to be working with people who are not disfluent. That's okay. We all have disfluencies, I hate to tell y'all. All right. So we all start, stop, restart sentences. We all repeat words. We all say, we all go, okay. So we all have periods where we're slightly disfluent. But for most of us, it's not a problem. You do not need to write down the entire reading sample. You just need to tell me which one it is that you're using. Document which reading sample was read. Duh, I just said that. Okay, so that's what you're putting there. Part B, clinical speaking sample. This is the picture plates. Use the picture plates to get the sample. Attach a transcription. This one you will transcribe. Like we did the other day in that table. You can do the same thing. Put it in a table, transcribe it, and then underline and count the syllables. Underline and count the syllables. You do not have to do it in a table. You can do it in Word and just put it in bullet points. It doesn't matter. All right. Whatever works easy for you. Some people have trouble working in tables. That's okay. But just put it where you can underline and count the syllables. So you're going to want the sentences on different lines so you can count the syllables and put the syllable count on the side. Then number 3 is beyond clinical speaking. This is the speaking tasks, our conversation. Include a syllable count, stuttering events, and figure out the computation. And that information is in the manual. Attach the transcription to this form when you turn it in, and underline and count syllables. So you're going to be turning in this sheet. This is the protocol. This sheet you see on the picture, and you're going to attach the transcription. Now, if you want to go ahead and plug in the transcription and just stick it under part B and stick it under part C and just turn this in as one document, hey, that's fine. No problem. Okay? As long as I get the information. All right. Now, what to consider when you're doing this sample. Analysis of the sample. You must have at least 200 to 500 syllables for each of the 3 sections. Each of the 3 sections. Example, I don't want any pepper has 7 syllables and 1 stuttering event. I don't want any pepper. I don't want any pepper. I have to ask Miss Claire about that one because she put that example in there. She put 7 syllables. Unless she's counting the want. I'll ask her. Maybe she might be thinking, I do not want any pepper. That might be it. I'll check on it. Anyway, I'll clarify that. Mark any repetitions as an R, prolongations with a P, blocks as a B, revisions as an RE, starters as an S, circumlocutions as a C, interjections with an I, and anything else that's unusual or strange, just make sure it's different from the other initials, okay? Put a legend so I know what it is, if it's something different. Include the following under each section, A, B, and C. Stuttering events per 100. So get a percent of the syllable stuttered. Include the number of syllables. And this is posted. If I don't have it posted yet, it will be posted. I don't know if I had time to post it before I left.
It is 7 syllables.
It is? What did I do wrong?
Did you count any as 1 or 2?
Any. Thank you. I don't want any pepper. Thank you, Tommy. I was like going crazy. I was like, what did she do here? See, I'm doing it too quick. Okay. It is 7 syllables. I don't have to go and bug Miss Claire. Okay. Then you're going to complete the assessment form. On the assessment form, there's a space for you to circle a speech naturalist score, which is explained in the instructions. You're going to complete all information on the first page. Remember to use the reader's table, which is at the top of this form. You will see that. So you're going to put the identifying information. You're going to circle the speaking task score and percentage. Circle the reading task score and percentage. You're going to add 1 and 2 and place the score in the box. You'll see that on the form. There is a box for you to do that. Circle duration scale. And you're going to get an overall score. Okay, so mark on table 2 and 3. It's on page 2 of this form. And then you're going to write a short paragraph about the clinical use of self-reports. And that's this other form. Oh, here it is. A form for self-reports, which is this form. Okay? All right. I know that it was a lot really quick, but I want to get to this video. I think this video is 12 minutes, and so we just have enough time. This video is from YouTube, so you can go and look at this yourself after we're done with this. It is about giving the SSI. Just FYI, the person in this video is feigning stuttering, but this is a teaching tool, okay? They're not doing anything to mock people who stutter. They're not trying to offend anyone. This is strictly a teaching tool, okay? All right, so here we go. I'm going to go past this part and past this part. There we go.
Sophie Robbins is a 5-year-old girl who has a stuttering disability. She was referred by her kindergarten teacher, Miss Silver, due to the fact Sophie was stuttering and getting very frustrated while playing with her fellow classmates. She started to shy away from others and play by herself rather than socialize. At around the age of 3, her mother started to notice her stumbling with her words. She saw it as a cute way to speak and soon she would grow out of it, since her own brothers had grown out of stutters when they were children. This causes no issues in the home, but has given Sophie difficulties in school. Sophie enjoys coloring, watching TV, and playing outside with her brother. English is the main language spoken in the home, where she lives with her mother, father, maternal Uncle Ted, and her paternal twin brother, James. When Ted was a child, he and his identical twin Alex both had a stuttering problem. They both grew out of the stutter around the ages of 10 to 11. James, Sophie's fraternal twin, has no stuttering disfluency. Mrs. Robbins gave birth 3 weeks early, but besides that had a textbook birth. Since Sophie is 5 years old and not at a 3rd grade reading level, she will be administered the non-reader portion of the test. When Sophie talks to new people, she gets nervous and her stutter gets worse. so it is expected that she will have difficulty with joint attention and trouble maintaining topic of conversation.
The test is administered to two different groups of people, readers and non-readers. Two verbal examples are required to score this test. Non-readers see the pictures on the easel and talk about them along with having a beyond clinic sample. Readers are able to read a passage in the manual and explain a picture or simply tell a long enough story to gain a sufficient speech example. An audio or video recording device is set up in the room to gather the client's speech to later score the result. Clinic speaking sample 1, reading task. This is an example of how this would be done since our client Sophie is 5 years old and not at a third grade reading level.
Okay, Sophie, so here's the story, and I want you to read it as fast as you can, okay? When the fisherman awoke in the morning, his wife began yelling at him. "All you do all day is fish," she said, "and we never get to go anywhere." The poor fisherman left the house and went to his boat. He went far out to about how unhappy his wife was. Soon he felt fine. He had caught a huge fish. After he got the boat, he heard a strange voice. "Please, what is that? I'm..."
Trying to get past so y'all can see. Okay.
Okay, Sophie, so here's a picture, and I want you to tell me anything you see, okay? On a farm, okay? What do you see? What types of animals are there? Chicken, pig, horse, what are these up here? Goat. What is this piggy doing? Flying. Isn't that weird? It's a little weird. What's going on over here? Do you know what that is? Aliens? Yeah, it's like a spaceship for aliens. Anything else? Bunny? Bunny with eggs. What else? What are these? Pay attention. Look at the picture. What is this chicken doing? Eating? What is he eating? Skeleton.
Although this is optional, the speech pathologist may want another speaking sample within the client's natural environment. A home video was sent to a speech pathologist showing an interaction between Sophie and her mother, playing and communicating because Sophie is a non-reader.
Dinosaurs, little lizard. Good. Did he eat the dog? Oh, do you want him to eat the dog? No. What should he? He is their finger. Oh. What is this? A chip. What do you eat, the chip? Well, I'm sorry.
Order to determine, along with the percentile
Fred. His name is.
page 1 of the scoring sheet includes information about the client's history and other important information. It also includes tables that determine the scores for frequency, duration, and physical concomitance. On page 2, the total score is determined, along with the percentile rank and the severity of the stutter can be determined. Page 3 corresponds to non-readers' frequency computations. These calculations are necessary to determine the percentage of stuttered syllables. Page 4 is for the reader's frequency computations. The SSI-4 can be scored manually.
Okay,
or
and then
by
I'm going to
using-
stop it right there because this last part talks about there is a video, a CD that comes that you can score the test with computer, but y'all aren't going to be doing that. So, all righty, I will see y'all on Friday. Y'all have a good day. Bye.